The asthmatics traditionally always lived longer because they had a defensive mechanism.
Yes.
That's very interesting. And what happened when medication started to be introduced?
Well, that's when the deaths from asthma were recorded. Prior to the introduction of bronchodilating medications, people didn't die from asthma.
Buteyko wasn't a politician at all.
He was an anti-politician.
Yeah, called them idiots. Inbreeding idiots, okay? Publicly. He did cling to truth, that's it. Somebody does have this first or second defensive mechanism. Somebody can't notice, right? There is some problem. And problem will be deeper and more severe. It will appear according to physiology, but it should be more severe and deeper. Maybe even cancer, okay?
And the spasm's caused by deficiency of carbon dioxide, and when you address the deficiency, the spasm goes away.
Asthma is a condition in which the airways of the lungs become narrowed or completely blocked, obstructing normal breathing. This obstruction of the lungs, however, is reversible. That is why asthma is technically called reversible obstructive airway disease. What you might not know is that this kind of obstruction does not happen only in the lungs, and that when it happens elsewhere, the actual cause is the same and also the remedy. The Buteyko method is with good reason well known for curing asthma, and in the next 2 episodes we are going to explain everything related to the history, the causes and the mechanisms as to why the Buteyko method is perfect for this condition. This in turn will hopefully clarify also why it works for every other chronic disease. Enjoy this new episode of the Learn Buteyko podcast. We are going to jump right away into this fascinating and also actually quite entertaining conversation. I hope you will enjoy it.
I have a friend from Glasgow who, as a child, remembered going to school with a handkerchief over the face because the smog was so bad. No one he knew had asthma.
Well-known fact, in New Zealand, many people have asthma.
That's not quite accurate, Vladimir.
Huh?
It is the highest level of recorded asthma of any country in the world. Not a lot of people having asthma.
Oh,
There's only one place in the world which has a purported higher level, but it's not on the same rate because it's an island. And this island enjoys the cleanest air in all of Europe. And it's called the Isle of Skye. And it also enjoys the highest level of asthma.
Interesting.
Yeah, it's the Isle of
Well,
Skye.
it seems you started on the topic in a very unorthodox way.
yes, Javier, because I told you, man, Christopher knows this story. I had to see some session of sauna with Buteyko, right? His clinic, etc. after gym. And you see, I was so glad, okay, my body was clean, my face, you see, I smiled, okay. I used to smoke. And Buteyko said, your body too clean. Let's smoke, Vladimir. What? After 2-3 sessions of sauna, because I did it, you see, I stopped smoking. He said, your body is so clean, it's not good. Your immune system should work, he said. That's why, okay, about asthma. Asthma, he said, it's second defensive mechanism. First, block nose, second, asthma. And he called, you see, people with asthma lucky ones.
Throughout history, they have a longer lifespan. The asthmatics traditionally always lived longer because they had a defensive mechanism.
Yes.
And the peculiar thing is that they might be a little not as fit, not as healthy, not as robust, because if they lost control of their breathing or whatever, they would develop asthma symptoms. But they also had the tendency to live the longest.
That's very interesting. And what happened when medication started to be introduced?
Well, that's when the deaths from asthma were recorded. In the medical literature, old literature, I mean, you can never be sure of the accuracy of it because, you know, how big were the trials and what was the research drawn from and so forth. But there was no recorded deaths from asthma until the introduction of bronchodilating medications.
Yeah, Buteyko made research about this, okay? Documentary, some notes. He couldn't find.
There's a branch of medicine which is, you can't really just call it historical because they're really looking at data going back a long time. But it's their job to do research going back even to ancient times. And they were actually able to identify some very peculiar surgical equipment found in Spain that was introduced by the Moors. And they were doing some sort of complex operations on veins and things. And they had all these like, terrifying looking things. But they were treating gallstone and all kinds of things with their rather horrific surgical procedures. But apparently they are effective. And this organization, part of its job was to categorize and to, you know, explain and go through the history of these various procedures. And the Moors, but it was this discovery in Spain. You might want to look it up, Javier. And they're the ones that were like, these people that did all this kind of research, they're the ones that reckoned it wasn't until the introduction of bronchodilating medications was there any reportage of asthma deaths. No, you didn't die from asthma.
Right, that's very interesting.
They got sick. It's dreadful. Can't breathe. It's horrible. Nightmare. But you're not dead. You know, and the medication was fantastic. You know, and then there was a Russian genius. He discovered a treatment for curing asthma forever with a surgical procedure. And all you have to do is cut the vagus nerve and you can't possibly have asthma. There's no situation in which you can have asthma. You can't get tightness in the chest. You can't get an asthma attack. You are cured.
You just die.
That's well, okay, that's one of the side effects.
The same academician who invited Buteyko first, because Buteyko was distinguished, scientist. He made research already, many research about heart problem. He invited Professor Buteyko first from Moscow when his Siberian branch of Academy of Soviet Union just was organized. And this academician gave professor, he was not professor yet, he gave Buteyko big laboratory with modern equipment.
Oh, Meshkelin.
No,
was it Meshkelin? No?
He was surgeon, right? And I remember even I had some guy who came for asthma treatment for Buteyko. I don't know, I can repeat name. Me Shao Kim. And this guy was looking for Buteyko because he came to him and he was academician, very famous surgeon over Soviet Union, right? Rewarded by gold stars, or some whatever. And he said, and guy, young man, had blood pressure about 250, systolic and diastolic about 100. It's a big gap, all right? And this, academician said, interesting case. No, young man asked him, how about my life? Can I survive? He didn't answer even, Very rude person, and he offered to cut this nerve. It was, beginning of arguing with Professor Buteyko, with Buteyko. Because he said, good idea. To cut your nerves, you can put your arm inside fire. You can feel nothing. Good idea. No, look. Buteyko was not, politician at all. He could talk only straightforward. Boy, nobody asked him to say something. Nobody asked him,
Yeah, but I mean, it's not really, it's not entirely fair to say he wasn't a politician. He was an anti-politician. I mean,
Yeah.
he got the chance to address that group and he called them all deep breathing and you have brain vessels.
Called them idiots. Deep breathing idiots, okay. Publicly. No, again, a little bit, okay. No, genius. What? He could not understand situation, okay. I mean, he just, you see, was, he did cling to truth. That's it.
It's very interesting, this research about no deaths before bronchodilators in asthma, because it touches upon one of the paradigms that Buteyko was very keen to portray about the medical system. He said that modern medicine thinks that the body is stupid, and nothing could be further from the truth. The body is very wise, and asthma is like a first or second line of defense against the loss of carbon dioxide. And that's why they lived longer. They were actually genetically stronger, as he said, yeah?
Yeah.
Yeah, otherwise, if you breathe so deep and somebody does have this first or second defensive mechanism, somebody can't notice, right? There is some problem. And problem will be deeper and more severe. It will appear according to physiology, but it should be more severe and deeper. Maybe even cancer, okay? I met many young people back in old days. They were what? Buteyko. Control pulse 5 seconds, 7, but they were young, 20, 22, nothing wrong, they were active. Buteyko said, you should check your tissue for cancer. Okay?
Yeah.
And 90% of people, they found, okay, some problem.
And that's the biggest problem with our method, because reducing your breathing or the volume of breathing is not directly necessarily, attention isn't being paid to reducing the depth of the breathing. And so we focus on reducing volume, which is good. Volume should also reduce, but it's the depth of breathing. If you breathe more deeply, then you will breathe out or lose more CO2, because CO2 is heavier. And that's a real, because the tendency is to slow your breathing down or to quieten it down, calm it down, keep it nice. Missing the point. You just missed it and you're so close. And it's not harmful either. You will still reduce, if you reduce your volume, of course you will reduce depth. Of course it'll improve the situation, but you miss the bloody point, the nub of it, which is depth of breathing.
Yes.
So unfortunate that the terminology we have to use, depth of breathing. You're a deep breather. What? You're a pervert. Is that what it is? You're a deep breather. It's some kind of insult, you know? So, but that's the nub of it. That's the nub. You know, if your breathing is, I don't know how you'd measure it. These CO2 measurers, capnometers, doesn't really work. But if there was a way, like a micrometer of some sort, that measured how much the air went in before it went out, I can't even imagine how you'd construct something like that. But that would be, you would find the critical juncture. That would be the point. Because no matter how you breathe, if it's shallow, you'll be fine.
Sure. And I can tell you, Buteyko invention. It's not practical, but if you use some long pipe, narrow tube, all right, in one nostril and no other hole, and if you breathe through this tube pipe, it should be long. The longer, the shallow you can breathe. Yes, because it's difficult. I tried myself when I had deep breathing. No, not so deep, but not quite shallow, all right? It's very difficult to breathe through using the long pipe, because some collision between in-breath and out-breath.
There's also something, if you can relax, particularly the diaphragm, and particularly get in a posture, they can do shallow breathing, but not necessarily for very long, but they can get it. But it's really buggerizing around, finding the right posture, which you would think is shoulders back, and no, maybe it's not. Maybe it's crumpled over to one side or something.
Asthmatic usually, most of them, they use posture like this. They bend, see their lean bodies forward a little bit, squeeze their chest, okay? It's easier. That's why Marcel knows, of course. Sometimes we ask people, okay, try to lean forward, put your elbows on desk in front of you, all right? Drop your belly, maybe it will be better posture for you to get shallow breathing. Because classical, yes, like this.
You can't relax your belly like that. The only way you can get any sense of the belly relaxing is to go forwards.
If that level of tension is there.
Yeah.
You know, like if a person's in good shape, oh, of course they can.
Yeah.
But if they're not in good shape, do you remember that Belgian woman we had, Vladimir?
Yeah.
We are 5 years. She got good results, and I remember Vladimir was buggerizing around with her for hours, trying to find the right posture. And eventually we found it, or he found it, they found it, you know? And because she could not do shallow breathing. Do you remember, Vladimir?
Yeah, yes.
She could do pauses. She could do not huge, and she had some really complicated, nasty stuff going on. And finally, Vladimir found the way for her to get shallow breathing.
Yeah,
I remember she was sort of like on one side.
Yes.
On the sofa.
Posture was not classical, no.
No, not classical, no.
Classical.
Like special for her, and she could get shallow breathing in that position.
Yeah. After she could do in many, after.
And the better she got, the more argumentative she became. I preferred her when she was sick. She was much more polite. And the healthier she got and the better she got, the more aggressive she got.
Yeah.
This is very interesting. There seems to be like a mental link with the illnesses that we treat. So severe asthma seems to bring about some kind of defense mechanism also in the mind, that when people start getting well, something is going on there that makes them, I don't know, in our experience, dominating, aggressive. I don't know how to explain it, but it's like, it's all over the place.
Yes, because body so wise, body understands when so difficult time to survive. And I think, just my assumption, body can turn off psychological mind. Shut up, it's not for you now, time for you. Yeah. I should survive, all right, shut up. And people just doing Buteyko technique very diligent, everything all right. But when they feel better, body a bit relaxed, psychological mind takes over and begins to talk louder. That's my just assumption.
Exactly.
No,
it needs energy. Eh?
Vladimir and I and Stalmatsky at that time were drinking a lot of vodka back some years and years ago, a lot. And I drank more than I should. I got completely hammered. And I went out in Vladimir's balcony and vomited in his lounge room, and then came out in the balcony and passed out and collapsed on the floor. And I was just left there, basically. And then I remember waking up and I could see Vladimir looking down at me. And I'm like, ah. And he said, "Don't worry, your breathing is very good."
Yeah. It was, yes. I remember Pop came. Oh, I should surf, Christopher. I should help him. He said, "Don't touch him. He's breathing very shallow. Can you hear?" "No, I can't." "That's it. Don't leave him alone, all right?" Because defensive mechanism. And of course, what a good example, because Christopher's body knew already how to breathe shallow. In situation of dangerous situation, body began to use, that's it, to survive.
I see.
It was a matter of survival too, I think, because I think I was well and truly poisoned.
It's typical story. I would like to emphasize. Like I had patients with a bit crazy, crazy. Yes. but she was in hospital and in intensive therapy room. Her level of oxygen was 58%. But she described after, she did everything according to Buteyko advices, all right? She refused to sleep in lie down position. She demanded prednisone. She demanded blanket, thick blanket, okay? She asked to give her some clock with alarm, okay? She put alarm, you see.
To do the poses, yeah, to do her
Yes,
practice.
to break her sleep, to do poses, okay? And her description, okay, point after point. Usually, normal, her email is such mess. Difficult to go through, okay? When she described how she spent her time in hospital, or very logical, point after point. Vladimir, I recall, I did like this, 1 point, 2nd point. And the end was walking through some patients and told them, sleep in sitting position and close your mouth, everyone, okay?
This really reminds me of, you know, some students that we are having now, and there seems to be a correlation and like A follows B type of situation between, you know, because their practice is millimetric. It's like they want to do it perfect and they do really well and they do all the poses that they need to do. But as soon as they start feeling well, they start sabotaging the work.
Absolutely.
And it's quite an interesting
Yes.
thing to witness.
I think it's very funny. No one else does, but
We'll see.
the wonderful commercial for Alka-Seltzer in the United States, and the commercial is a guy at a baseball match, I guess, or maybe football. You don't really see the game, but he's there, and like a true American, he's eating a hot dog, and he gets halfway through the hot dog, and he gets heartburn, and he's in pain, and his friend notices. So his friend, good friend, has Alka-Seltzer handy, so gives him an Alka-Seltzer and a drink or something, and in a few minutes later, the guy's fine, laughing, carrying on. He then starts to eat another hot dog. Wasn't this the thing that brought it on in the first place? And it seems to be the human nature.
Mm-hmm.
The very ideas and attitudes that got people into trouble in the first place, once they're taken out, they didn't draw the correlation yet between their ideas, philosophy, behavior, or attitude, or whatever it is, and their disease. They didn't make the connection.
Yeah, and it's very obvious. It's almost like as soon as the psychological mind starts reacting, it's like it wants to take them back to where they were before. It must be some payoff of some kind. Is a very interesting phenomenon. Okay, I wanted a little bit to touch on the history as to why Buteyko is known for curing asthma, because the reality is Buteyko is good for all chronic diseases. But and the truth is also that in the Soviet Union, it was actually the official treatment for many chronic diseases, not just asthma. So it was a little bit in the introduction of Buteyko to the West that asthma had this sort of relevance. There's in fact this BBC documentary, very well done, I think it's in the early 90s, where Stalmatsky is the protagonist of it, where he cures 3 people of asthma, and then there's the doctor saying like, well, this was interesting, but I'm still not convinced, and all of that, like, as one doesn't know what would this person need to see in order to be convinced, but hey, that's what he says, right? And
he said in that particular episode, he said, when the reporter asked him, what's your response to his skepticism? And Stalmatsky says, he can't believe his eyes. How can he believe my words?
yes.
So the guy couldn't believe it. And then at the end of it, he said, oh, we knew all that. Of course, we always knew that. Of course, hyperventilation, but of course, it's just like these people are just completely political.
Yes.
There's just absolutely not a shred of like, well, that yes, we should look into that. That is an interesting point. Yes, I must get together with my fellows and go over that and have a look at the literature. Yes, you've got a point there. No. Oh, we knew all that. Of course. Oh, yeah. You know, you've said no, impossible, unlikely, not going to happen. Psychological, nothing in clinical evidence to show this to be accurate, blah, 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 blah. And then it works.
And not only did it work for the mild asthmatics, it worked for the very severe asthmatic.
Yes, exactly.
They call, to my recollection, it's like placebo effect. Because they thought Stalmatsky is such a shaman. He used some magic, all right? That's why they call placebo effect, to my recollection. And
Really?
Christopher knows better why you see Christopher and Stalmatsky, she pointed only asthma. Better to ask Christopher.
Yeah, well, that was an instruction because Buteyko knew that if we promote outside of asthma, then the theory, the hypothesis is too big and too ridiculous. So asthma, breathing method, asthma, you know, but if you say breathing diabetes, they can't make the connection. But on the one hand, that's what he ordered. He laid down the law in that regard that that's what we should focus on. But of course, it naturally led to emphysema and COPD because they take the same medications that asthmatics take. So there's no medication that I know of. There's no real medication for COPD or emphysema. They just take prednisone. They can take bronchodilators. They can take other things along those lines. And they're all basically asthma drugs.
Yes.
But, you know, one should understand something. You've got asthma, which is spelled ASTHMA. And then you have an asthma, which is an ASMA. And it's an incident. It's where there's a constriction. I can't tell you if it's referring to a sharp, dull, persistent, chronic, or whatever, but it is a constriction. And asthma is a constriction. And asthma of the bronchus was called bronchial asthma. That's what it was called. And migraine headaches used to be called asthma of the brain.
Yep.
And angina pectoris used to be called asthma of the heart.
Absolutely.
And yes, and so there were quite a few diseases which had this term asthma, and then they changed it. I mean, it's a bit about like the law profession. What they do is they sort of make out that they're speaking English, but they're not. They're speaking legalese. And so when you answer in the wrong way, you get all into all kinds of contractual problems because you agreed to something, because you said that you understood, which means to stand under. So all this hocus pocus with words, and that hocus pocus came into medicine, and they're very good at it. They do it with medications a lot. In the old days, I'm blathering on now, but in the old days, anybody with a rough knowledge of the pharmacopoeia of things could look at the name on something and they knew what it was. Because if it ended in ONE, it was a steroid and all that sort of stuff. So likewise with the diagnostics, and then they changed it. They started calling it asthma, and then they started calling it migraine headache, and then they started calling it angina pectoris and other things. So the linkage is there prior to this latest incarnation of modern medicine.
Well, would constipation be asthma of the colon?
If there's I mean,
yes, I think because asthma means some spasm.
Constriction, yes.
Constriction, okay? That's why where the constriction occurs, it should be called asthma.
And then high blood pressure?
Sure, because blood vessels are getting narrow.
The vessels are constricting.
constricted, yes. It's to my recollection, maybe I'm wrong, but people see code back on old days like that. Asthma, yes, for heart, asthma for intestines, asthma for whatever, blood vessels, or off.
Because the cause is the same one for each one of them. Yeah.
So, and the spasm's caused by deficiency of carbon dioxide, and when you address the deficiency, the spasm goes away.
I hope you enjoyed this episode of the Learn Buteyko podcast. We are going to continue with this conversation in the next episode. In the meantime, remember that you can find out more about the classical Buteyko method in our website, learnbuteykoonline.net, where you can find out about free webinars and testimonials from students of the method. And don't forget that if your mother language is not English, we run workshops also in Spanish, Greek, Hebrew, and more. It will be possible, for example, to do it in Italian, for example. Join us in our next episode where we will continue talking about asthma in relation to the Buteyko method. Thank you.